Bismillah Rahman Rahim. Assalamu alaikum. Dear colleagues and PGs, from today we are starting our discussion on pregnancy-related liver diseases. In these 5-6 vlogs, we shall discuss what are the pregnancy-related liver diseases, what's the impact of pregnancy on liver, how the liver functions are affected in pregnancy, and then we shall understand the pregnancy-related liver diseases by studying different case histories, and we shall understand how these diseases, the hepatic disorders, they are different from one another, how we can diagnose them within time, and how we can intervene, how we can treat them, and how we can prevent their deleterious effects on the pregnancy outcome. So today is the first introductory vlog on the pregnancy-related liver diseases. Bismillah Rahman Rahim. As said before, today we shall start our discussion on diagnosis and management of pregnancy-specific liver diseases. We know that the liver disorders specific to pregnancy are rare, but can have potentially serious consequences for mother and fetus. Pregnancy-related liver disorders are the most common cause of liver disease in otherwise healthy pregnant women and pose a challenge because of the need to take into account both maternal and fetal health. A good knowledge of these disorders is necessary as prompt diagnosis and appropriate management results in improved maternal and fetal outcomes. So we have learned that liver disorders specific to pregnancy are rare, but can have potentially serious consequences, both for mother and fetus. These pregnancy-related liver disorders are the most common cause of liver disease in otherwise healthy pregnant women and pose a challenge because of the need to take into account both maternal and fetal health. And the third important point is that a good knowledge of these disorders is necessary as prompt diagnosis and appropriate management results in improved maternal and fetal outcomes. When we analyze the routine parameters of liver functions to understand the biochemical changes during pregnancy, these are bilirubin, ALT, AST, alkaline phosphatase, 5-NHT, GGT, prothrombin time, albumin, total proteins, alpha-fetoproteins, platelets, and cholesterol. What changes happen in these parameters during pregnancy? This is important to understand the pregnancy-specific liver diseases when we define that, yes, this is a pregnancy-related liver disease. We need to understand what are the routine changes, what are the normal changes which happens in these parameters. To understand these changes, we will code them with different colors. Those who are blue colored, like bilirubin, ALT, AST, and GGT. Those who are orange colored, like alkaline phosphatase, alpha fetoprotein, and cholesterol. Those who are green colored, like 5-NH-NT, prothrombin time, and platelets. And those who are yellow colored, like albumin and total proteins. This is important, and why I have given them different colors, I'll explain to you in the next few minutes. Those parameters who physiologically they are increased during pregnancy, these include alkaline phosphatase, alpha fetoprotein, and cholesterol. And we know why these are increased. Because the placental origin for alkaline phosphatase, and then the fetal origin for the AFP, and the cholesterol by the mother. So these three parameters, they are increased: alkaline phosphatase, alpha fetoproteins, and cholesterol. So they are colored as brown. Those parameters who remain normal, there is no change, and these include 5-NT, prothrombin time, and platelets. So these parameters, they remain normal during pregnancy. Then those parameters who are normal are decreased, who may be normal or who may go down. These include bilirubin, the blue colored, ALT, the AST, the GGT. So these four parameters, bilirubin, ALT, AST, and GGT, they are either normal or they may go down, their level may decrease slightly. And then those parameters would definitely go down, whose levels are decreased. These include albumin and total proteins. That's the reason I gave different colors. I coded them with different colors to understand that which are the parameters who are increased, which are the normal liver parameters who remains normal, which are the parameters who remain normal or mildly decreased, and those parameters who are clearly decreased. When you understand this, when you have this knowledge, then it becomes easy to diagnose different liver diseases in the pregnancy. So if another way, if we group them, so those parameters who are increased, these are alkaline phosphatase, cholesterol, and alpha fetoprotein. Those who remain normal, these are 5-NT, prothrombin time, and platelets. And those who may be normal are mildly decreased. These include bilirubin, ALT, AST, and GGT. And those who are definitely decreased, these include alkaline phosphatase and total proteins. So this knowledge is mandatory. This is a prerequisite to make a diagnosis of pregnancy-specific liver diseases. Again, this is the same thing, and giving the levels of hemoglobin, white blood cells, platelets, PT, alkaline phosphatase, albumin, ALT, AST, GGT, bilirubin, and bile acids. In the non-pregnant, what are the levels in the non-pregnant ladies? Then in the first trimester, what happens? Then in the second trimester, what happens? And then in the third trimester, what happens? For example, hemoglobin in the first trimester, the hemoglobin is between 12 to 15.8, while in the first trimester, it dips down, second more, and the third remains the same. Then WBC count In the non-pregnant ladies, the first trimester, second trimester, and the third trimester. Mildly increased in the third trimester, the lower limit. Platelets, then the PT, then the alkaline phosphatase, albumin. So all these, when we see the different categories like trimester, first trimester, second and third, again, there may be mild change in it. And these tables, reference tables are available and you can consult to them anytime. This is again taken from the Journal of Hepatology last year. The EASL values of these blood counts, the electrolytes, the liver function test, inflammatory markers in the non-pregnant ladies, in the first trimester, in the second trimester, and in the third trimester. So the normal physiological background and the values are very, very important to diagnose these diseases with confidence. So what are the pregnancy-specific liver diseases? And what we will discuss in the upcoming few vlogs, one by one, to understand that how these diseases present, how we diagnose them, and how we treat them, and what is their impact on the pregnancy. We shouldn't forget, we should remember the Hyperemesis Gravidarum. This is the first pregnancy-specific liver disease, the GI disease, and this is very, very important. We will see what changes happens in the liver functions in this condition. The second condition not to forget is the intrahepatic cholestasis of pregnancy, or ICP. The third condition is Pre-Eclampsia and Eclampsia. And the fourth condition is HELLP Syndrome. And the fifth is Hepatic, Hematoma, and Hepatic Hematoma and Rupture. And the last one, acute fatty liver of pregnancy. So it is important to remember these 6 conditions. And they present, we will see in the upcoming vlogs, that when they present, how we can diagnose and how we can treat them. So the Hyperemesis Gravidarum. Then the second condition we shouldn't forget is the intrahepatic cholestasis of pregnancy. Then the Pre-Eclampsia and Eclampsia. Then the HELLP syndrome, hepatic hematoma and rupture, and acute fatty liver of pregnancy. So I stop here. In the next episode, we shall discuss the first case history and understand what's the condition, what is the differential, and how we treat it. So be with me. See you in the next vlog on the first case history of pregnancy-related liver diseases. Take care. Khuda Hafiz.